Omicron is spreading so fast in India. As on today, all the states in India in the grip of Omicron. Now the central government has instructed the state government to strictly improve their infrastructure, especially health infrastructure. But when the government has instructed the state governments to improve their health infrastructure, the government of India has forgotten that it should give a booster dose to the healthcare workers, especially the doctors, nurses, and the frontline staff. If these people are infected because of Omicron, there won't be anyone in the hospitals to take care of the Omicron patients. According to a study in the Lancet journal, that the efficacy or the effectiveness of AstraZeneca, in India we call it Covishield, is only 3 months. After 3 months, it starts waning. Its efficacy will come down. In India, all the healthcare workers have been vaccinated 6 months back. Some of them may be in the beginning of this year. Now you can see what efficacy, effectiveness these vaccination have on our doctors and healthcare workers. So now that is the moot point. We don't understand why the government is not taking effective measures, why the government is not going very fast in giving booster dose. If not for the entire population, they should be giving booster dose to the health line, front line, and the doctors, nurses who are going to take care of the patients. Because the third wave is not far. Maybe in the first week of Jan, or maybe by the first week, or maybe in the second week of Jan, or maybe the second week of Feb, we are going to have a third wave. So according to some researchers, according to some study, India is going to have more than 1 lakh cases per day as UK, which is presently in the grip of COVID-19, a new variant, a heavily mutated variant called Omicron. Now we can learn an experience from the United States. All the pilots and the crew staff of the airlines have been affected. They have applied mass sick leave. As a result, tens and thousands of airlines or the reservations have been cancelled in the USA. That too in this festive season. The Christmas holidays are very important there, and they could not move from one state to the other state to be with their near and dear ones to celebrate the Christmas and the New Year Eve. We should take a cue. We should learn from that, because the pilots got infected and the airlines have been collapsed. If our doctors got infected, the whole health industry, the health sector will collapse. If doctors are not there, who will take care of the patients who are going to surge in the coming months? So my take here, we have plenty of vaccinations. We should be proud that India is one of the leading countries in the world where there is no scarcity of vaccines. We manufacture, and we should be proud that we export to other countries. So Covishield, we have enough of vaccinations. The government should immediately go in for this, to give vaccination to the healthcare workers, doctors, nurses, and frontline staff, even the policemen, even the other staff. Number 2, elderly people, and number 3, the people who are immunocompromised or who have comorbidities. Not only this, now in many of the states, the schools have been reopened, the colleges have been reopened, the poor children attending the classes without any inoculation or vaccinations. The government should come out immediately to vaccinate the children below 18 years. We should learn from other countries. Japan has started giving booster dose to all the citizens. Israel is going in for the fourth booster dose, the fourth dose in fact. The third booster dose is over. Now because of this panic, they're going in for the fourth dose. And in UK, because in UK, the Covishield or Omicron, on an average, the cases are coming more than 120,000. So they made it a point. They decided that by the end of this year, they're going to inoculate or going to give booster dose to all the citizens there. So my take here, it is earlier for the government to take graded steps in terms of giving booster dose to especially those people. If not for the whole thing, okay, the government has a policy. First, let's give 2 doses to all the eligible people in the country. Okay, it's fine, but at least they should be giving it to a booster dose to doctors, elderly and other peoples who have immunocompromised, and then school children too. Otherwise, we are going to face the same thing what we faced in the second phase. Okay, that time we never had vaccinations and we never had a proper data to know to what extent the dangers of this vaccination. Now we have enough data, we have vaccinations. Let's make best use of them. Thank you guys for watching. Goodbye. Do subscribe, share and like our videos. Bye bye guys.